Hi everybody, I'm Dr. Albert Malvehi, a East Bay vein specialist, also known as Dr. Vein Eraser. And what we're going to talk about today is diagnosing lower limb or lower leg varicose veins. So people will look for, if I have veins in my varicose veins in my lower legs, where are they coming from? How are they diagnosed? How are they treated? So I'm going to talk mostly about the diagnosis and where they're coming from today. And we have some other videos on treatment that you can search for. So varicose veins in the lower leg, let me even start farther back. When we say lower leg, what we're talking about is below the knee, okay? So if we look at, for example, these two people here, they have varicose veins that are most prominent below the knee. And these are sort of the most common places for varicose veins to be. Other people will have them in the thighs, but varicose veins in the lower legs are sort of the most common place for varicose veins to come from. So in terms of diagnosing them, where do they come from? Well, then we actually have to look at the whole leg, because most of the time they'll be coming from the thigh, from this area where in this particular person, there's no visible varicose veins. That's actually where the problem was. And to show you a little bit about that, we're going to look at this chart over here. So this is a chart of the front of the leg and the back of the leg. And in the center of both charts, you'll see that there's a dark blue line. Those are deep veins. I'm not going to talk about deep veins very much other than to say if you've ever heard of someone having a DVT or a deep vein thrombosis, or what's commonly called a blood clot, this, if it's dangerous, it's in this dark blue vein. And this is the same vein just shown from the front and the back. On the front of this, we have a graphic image of a vein running down the inside of the thigh, down the inside of the calf, all the way down to the ankle, and making a little arch. The name of this vein is called the Great Saphenous vein. That's just the name of it, okay? And there's various other veins in the leg. We're going to focus on this one because it's one of the most common ones where varicose veins can come from. So what happens is that the Great Saphenous vein in many people, usually just for genetic reasons, just something you're born with, is too loose, okay? So veins in the legs have a special job. They're meant to transport blood up against the force of gravity so it can be returned to your liver, lungs, kidneys, and heart to be refreshed and recycled. And it has to sort of get blood up against the force of gravity. The way that happens is that your calf muscle squeezes, blood gets pushed up, and there are little tiny one-way valves inside the veins. They're actually little valves. They look just like this, little leaflets. And when you walk, your calf muscle squeezes, the leaflets open to allow blood up, and then they close back down. They go through one-way valve. Blood's supposed to go up and stop, up and stop. And people who have varicose veins typically are born with a great saphenous vein, or this other one over here called a small saphenous vein in the back, or some other veins, where the vein is too loose. And these leaflets, they don't touch, and that's what's going on. So the vein is actually too wide. And so they walk, the leaflets blow in the breeze, and then allow blood to flow backwards down to the floor. So what happens when blood flows down with the force of gravity instead of up, over years and years and years and years and years, we'll find little branches. And if these branches dive down deep into the muscle, people will feel that, like heaviness, aching, cramping, restless legs. They might see it like leg swelling. Again, this is a mechanical defect that you're born with, but it shows itself over time because it takes time for that pressure to cause trouble. All right? Other healthy veins are compensating for the work this bad vein is doing since very early on in life. This non-working vein, if it has branches that are close to the skin, like these people over here, again, you can't see this great saphenous vein. It's under the surface of the skin, which is why we use an ultrasound. We see blood flowing down, and then if the branches are close to the skin, we'll see those as varicose veins. So when the vein is not working properly in the thigh and allowing blood to flow backwards down that great saphenous vein, the medical word for that is venous insufficiency. You might also see the word venous reflux. Those two things don't mean exactly the same thing, but for our purposes, they're essentially interchangeable. There's just fancy medical words that mean the vein's too loose, it's allowing blood to flow the wrong way. It's a non-working vessel. So I can talk more about treatment in another video, but that's where varicose veins in the lower legs come from. Signing off, Dr. Vein Eraser out.